Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the way that tick-borne illness organisms behave once you start treatment. So a number of patients have asked me, why it is that once we start treating, first Bartonella seems front and center, and then Babesia seems front and center, and they're right. Typically, what I like to do is start out with treatment by doing some detox and some lymph support to just get things flowing. You got to get things flowing because oftentimes with chronic illness, everything becomes like stuck and congealed and tight, kind of in a vasoconstrictive state. So you kind of want to open up the vessels and begin to detox and get lymph to flow. And then when you start treatment, and that can be with herbs or antibiotics or both. And let's say the patient has Lyme, Babesia, and Bartonella, which is sort of a common triad. Whatever organism is front and center, you can tell by the number of symptoms that are associated with that. For example, if Babesia is front and center, you're going to see a lot of night sweats, air hunger, maybe crown pain, and that's going to alert you, and fatigue. That's going to alert you that, okay, Babesia might be front and center. And so you make the protocol stronger in Babesia, antiparasitics, and herbs. And then the herbs and antibiotics that treat Lyme and Bart are sort of at a lower capacity. And then as the patient goes through treatment, Babesia will come down and one of the other ones will go up. Bartonella and Lyme will go up. And then you treat those symptoms. And then that one will come down, and then the third one will come up. And then you treat those symptoms, and it's this constant symphony and flux of organisms as you begin to bring the pathogen load down. And this is very, very common with patients that have multiple tick-borne illness. And it doesn't just have to be Lyme, Babesia, and Bart. Could be Ehrlichia, could be Anaplasma, could be Rickettsia. That is the way it goes. Now, interestingly enough, when you have secondary infections like, let's say, Epstein-Barr or pneumonia or HHV6, those symptoms generally don't come and go. They stay rather constant. And so you have to try and bring those down at the same time, and they'll come down at a slower rate. And you can use herbs and antibiotics and mix them in with all of the tick-borne illness treatments and mold illness treatments. If you don't treat everything at once, it's going to be a problem. Now, there are exceptions to that. Very, very, very sick patients, bedridden patients, patients with severe MCAS, you can't treat like that. You have to treat only the organism that is most prominent, in my belief. And you have to deal with the MCAS, and you have to deal with detox and all of that. Otherwise, the patient will become overwhelmed, and their detox pathways will become overwhelmed. So that is some particular things to think about when you go into treatment and when you see that your symptoms are changing. First you had night sweats, shortness of breath, headache, and then those go down, and now you have foot pain, you have rib pain, you have eye pain. That means Bartonella's there. And then they go down, and then you have, brain fog, neuropathy. That means Lyme is probably there, or at the front. And that's the way that healing takes place. It's the symphony of who's in front, and then bring that down, this one's in front, bring that down, this one's in front, and it'll flux all through your treatment. And then it will get lower and lower and lower and lower and lower. And then hopefully you get into remission. And for some patients, hopefully maybe even a cure. So I hope you found this information helpful, and have a great day. Take care.